I am a palliative care physician, and so I think of myself as a quality of life doctor. And so I work with patients and families who have serious illness, and that's what I do before the pandemic. And I think of myself like a quality of life doctor. So anybody who has severe symptoms, like I work a lot with cancer patients, and so anybody who's having a lot of pain or nausea, I work with them to make their lives better. And I work a lot in the hospital already with patients with serious illness. And so some people are nearing the end of their lives, and helping them just get the best care and live their best life, and helping their families cope and move through that space with as much support as we possibly can.
That's got to be tough, to say the least.
It's definitely some hard and heavy work at times. And I know that this is going to happen to people. People get sick and it's what happens. And if I can be there to support people on some of their worst days, that's a really good day and a really special role. And I love the work that I do, to be honest.
That kind of intensive care that you do when people are really, really sick, I'm assuming now that includes when people are diagnosed with COVID.
Yes. And I've got to say that there's just such a stark contrast in the care that we can provide before the pandemic and the care that we provide to patients after the pandemic. And it's kind of across the board. So you can imagine that beforehand, if someone were being put on life support and they were on these machines for weeks and on ventilators, which is where they have a breathing tube down their throat, and there's a machine that's breathing for them. It's not uncommon that medicine has limits and we can't make them better. And families know that their loved ones wouldn't want to live on machines forever. And so they'll make the decision that they're going to let their loved one be at peace and they're going to let them pass. And before, their 3 children would come in and hold their hands and be able to say goodbye, and their spouses and their children's spouses and grandchildren. And people would come in with guitars and sing their favorite music, or their pastors, and have them pray. And there would be crying, but there would also be laughter and storytelling and grief and togetherness. And it was hard, but also there was a lot of beauty in those families being able to be there. And now with COVID, the hospital has to protect the patients and also the staff and the families of the patients. So the visiting policies are just heartbreaking. And we wanted to make exceptions for people to be able to come in and say goodbye to their loved ones that are dying with COVID. And a lot of times we can't at all. Or we let one family member in for 15 minutes with a mask and sometimes a face shield and a gown. And that's the only time that families have. And that's some of the most heartbreaking, hard work, is not only having so many people that are tragically affected and losing multiple family members, but that also they can't have those moments to grieve together and work through that grief and have the love and support of their families. And I have a love-hate relationship with Zoom, but a lot of times Zoom is the only way that they get to say goodbye. And it's tragic and heartbreaking.
How tough is that on you to be the person who's in the room having to witness that firsthand?
Yeah. Or having to be the one that tells the family that they can't be there. I got to say that both of those roles have been just so heavy, and watching, like, having to have that conversation multiple times a day, every day, of your loved one is dying, and no, you can't come in and hold their hands, and you have to say goodbye over Zoom, and how hard that is, and having to do it every day, multiple times a day for weeks now, and watching those numbers still climb has just been, I'm not going to lie, it's been really heavy and really tragic. And a lot of our team is feeling that weight.
You mentioned watching those numbers still climb. Recently, we're hearing things are flattening out a bit, things are looking better. From your perspective, what are you guys seeing? Because it sounds like things aren't getting better.
I mean, there's a delay, right? And so the new case numbers are flattening, but we saw those spikes just last week, and the hospital is still just so full, and there's so many patients that have died just in that last week that while the numbers are starting to go down, it's probably going to be a while before there's a big sigh of relief in the hospital that the numbers are back to a more manageable level.
Are you just overwhelmed all the time?
Thankfully, not all the time. There are times that I am completely overwhelmed, but we have a really amazing team that's very supportive of one another. And I take a lot of strength from my friends and my husband and the support that I get from my community. And it really has made a world of difference in my life right now.
Because it sounds like, especially when there are those limitations and people can't visit their loved ones, you kind of become that substitute loved one.
We are there and holding that loved one's hands and listening to the families say their goodbyes and watching mothers lose their sons. And it is so hard to sometimes bear all of that. It's true.
What is your message to the community right now as we're still very much in this pandemic?
Yeah, my message would just be that this is serious, it is real, and people are dying. But the disease isn't magic. It's preventable and it's not forever. And if we could be united in really locking things down and wearing masks, we will be in a hugely different space in 3 months from now. And so, I know that the public health officials are starting to come out with the 100-day mask challenge. And I would 100% support that. Start counting those days, but follow through right now. Keep distant and know that if we do that, there will be an end in sight and it won't be, this just ongoing wave of everything. And then my final message would be, COVID has been tragic, but what's also been really tragic is that there have been a number of cases of patients coming into the hospital really late with cancer that has spread all over their body, or ruptured aortas that then they didn't get blood flow to their brain and they had brain damage. And so I would just say, if you have a medical emergency of any kind, not just COVID related, come to the hospital. We have the medical equipment and the PPE to keep you safe and get the care that you need.
It sounds like you've seen a much darker side of this pandemic than most of us would ever care to see. You're sometimes, I'd assume, the last person people see before they pass away.
I hadn't really occurred to me, but I think that that's been true for a lot of patients this year. If it's not me, though, it's a lot of times their bedside nurses that are right there holding their hands too. And man, those guys are some amazing colleagues to have, and I'm so grateful for their work.
That's a lot of weight on all of your shoulders.
It really has been. And I mean, I think it's one of the reasons that, like, the first wave of the pandemic, there was like a lot of unknown and a lot of uncertainty and anxiety that way. And this most recent wave, it just feels like we're tired and people are dragging, and we're all trying to carry each other through this really hard time. And it would mean the world to all of us if we could band together as a society at this point and take the public health measures to not end up in the ICU, not have so many end up in the ICU.
Dr. Mills, thank you for your time, for your honesty, and for your clear compassion for your patients. It definitely does not go unnoticed.
Thank you. And it's a real honor to do this work. But this COVID pandemic has been just really different, and I really look forward to brighter days.